The origin of this work was really an early outreach request from the UN agency UNICEF to assist them in examining and assessing the degree of victimization of girls and women also, I believe, in Swaziland. We indicated that we had the ability to do a field survey to get better numbers for the rates of victimization. We entered into a partnership with UNICEF. They were able to assist CDC directly by helping with some funds, and the limited funds that we had allowed us to send a team to Swaziland. We completed the survey, whose results were released late last year, and whose findings were published in the journal Lancet in the spring of this year. Those results were widely publicized and used in the medical and public health field as an example, as the first example of its kind of how you could get at hard numbers of this kind of problem particularly in difficult circumstances of a developing country. And they noted that, for example, the response rates on the surveys, the field surveys, were up as high as 80%, which was extraordinary for a survey of this kind, or a survey of any kind, actually. The country of Swaziland was able to take action on this problem. They began to develop policies for the protection of children, and made a wonderful commitment to raise the priority for addressing this problem. The Deputy Prime Minister came to the World Health Organization and shared his experience in working with public health and CDC, and challenged other countries in his region and around the world to do the same. So it was a really extraordinary example of data driving action for an important human concern. This augments what CDC had been doing earlier in Swaziland, addressing this very difficult problem, which also is a contributor to the HIV transmission rates in these countries. And without this support, CDC would have been absolutely unable to meet a steadily increasing demand to measure the incidence and prevalence of this kind of victimization. We simply do not have the numbers of staff and travel support to do these kinds of surveys without the CDC Foundation's help. And the Foundation's help has just been exceptional, and really, I think, sets the stage for a much broader effort in the future for CDC to do this kind of work.